Hello, everyone, and thanks for joining us on our OnERcall series.
Welcome back.
Today, we will give a brief overview on headaches.
So headaches, it's a very common symptom and complaint that we see in the emergency department. Just last night I had a patient that came in with a headache. Thankfully the workup was okay, we got the patient feeling better, but at the end of the visit they asked me, "Hey doc, did I really need to come in for this?" And that's why we made OnERcall to help answer that question for you.
Right. So, what actually causes a headache? It's not usually the actual brain itself, it's usually the pain sensitive structures like the hair, the skin, the muscles, the nerves, the arteries. So, let's dive into it. Less concerning, more concerning.
For sure. And so some of the less severe types of headaches, they can be caused by stress, lack of sleep, not eating well, not drinking enough water, not staying well hydrated. And there are different types. We're going to touch base on a few of those.
Yeah.
One of the most common types is a tension headache. This is a headache that feels like a band around one's head. Usually not associated with any neurological deficits, no weakness, no numbness. There's no changes to one's vision, no changes to one's speech. And for the most part can be treated with non-steroidal anti-inflammatories and over-the-counter medications. Getting some rest, even some hydration. Another type is a cluster headache. These headaches come and go in clusters, and they usually are one-sided, usually associated with younger males, and again can be treated with these supportive measures we just talked about. But sometimes these patients do need to come to the emergency department and receive supplemental oxygen, where we actually give them some oxygen to help them feel better.
Right. Another less concerning type of headache is a migraine, and that's very common and usually chronic. Sometimes a result of nerve inflammation, serotonin transmission. Migraines can often be associated with auras. Auras are premonitions or feelings of developing a headache, lights flashing. These headaches are usually associated with nausea, vomiting, light sensitivity, sound sensitivity. Sometimes these headaches can be associated with neurologic deficits like slurred speech, weakness. When you start getting neurologic deficits, they should get evaluated in the emergency room.
And that kind of transitions us into the more severe type of headaches that we're going to talk
Right.
about.
So we gave an overview of the less concerning, now more concerning.
So these types of headaches can be deadly, lead to permanent paralysis,
And even death.
and even death. And so to start off, we're going to talk about headaches from a tumor or a lesion in the brain. These types of headaches are usually chronic but slow in onset. They gradually get worse and worse over time. Can be associated with other symptoms like unexplained weight loss, loss of appetite. People can wake up in the middle of the night drenched in sweat. And the way to diagnose this type of headache, that the headache is coming from these lesions, is to come and get a CAT scan. And the
Right.
quickest way to do that is come to the emergency department.
Another concerning type of headache is what we call temporal arteritis. Common in females over the age of 50. It's inflammation of the temporal artery. We have two of them, each over our temple. You'll get pain, inflammation, warmth. What's so important about these? They can sometimes lead to one-sided blindness and sometimes even strokes. So another type of headache that needs to be evaluated in the emergency setting.
Absolutely. And that kind of brings us to the last one of these severe headaches we're going to touch base
Right? The
now.
subarachnoid
The
hemorrhage.
subarachnoid hemorrhage, and that's bleeding in the brain. And the common presentation of these patients come in with complaining of the worst headache of their life.
Right.
It's like,
And they can sometimes pass out and then fall or get into a car accident.
and it's usually caused by a brain aneurysm. Trauma can cause it. There's other different causes, but the most common causes of an aneurysm that, quite
Right.
frankly, explodes in the brain.
Right? It's a weakening or ballooning of a portion of the artery, and then one day it explodes.
And so we kind of broke it down into the less severe and more severe types of headaches. And if you ever have any questions about headaches or anything else, please feel free to reach out to us at OnERcall. We are
Yeah.
here to help.
Yeah, we would love to talk to you. Thank you.
And join us for our next video series.